So Emily, today we want to talk a bit about how we might build ourselves back up to some impact exercise, or possibly even returning to running postnatally. Or in fact, this might also be relevant if you have a prolapse. So it might not just be postnatal.
Okay. So if we look at sort of timeframes first of all, so it's generally not advisable to return to any form of impact exercise prior to 3 months after you've had your baby, just because it takes that long for sort of the soft tissue structures to heal around the tummy area and the vaginal area. We don't really want to be putting too much excess strain on those structures for that time period. And then looking at symptoms, so if you're very symptomatic with your pelvic floor, so if you've got any urinary symptoms, for example stress incontinence, so leaking with kind of a cough or a sneeze or walking, or any sort of vaginal heaviness, so kind of a dragging heaviness in the vaginal area, which may indicate one of your pelvic organs has started to descend a little bit into the wall of the vagina. Generally, you'd want to come and see a pelvic floor physio and have an assessment. And we'd want to try and strengthen your pelvic floor muscles up to make you less symptomatic, so that when you were then stressing your pelvic floor even more, the symptoms wouldn't then worsen. The 3-month thing does depend a little bit on your activity levels prior to pregnancy. Some people will continue exercising all the way up to having a baby, and you know, if you're sort of very used to a lot of exercise, potentially you might want to go back a little bit sooner. But if you are very symptomatic and you're taking a long time to recover, if you've had any significant obstetric injuries, kind of tears through the perineum, you might want to leave it a little bit longer. Thinking about kind of readiness to return, particularly if you're breastfeeding, you need a very supportive bra and footwear. So generally during pregnancy our foot size increases a little bit, so kind of get your trainers out and just make sure they still fit. They might be a little bit small. The other things that can happen are people can start to get sort of pregnancy pelvic girdle pain. Again, that does usually settle down after you've had your baby. If it doesn't and you're still getting symptoms, it's worth trying to settle those down before you start anything sort of too impactful.
And are there any particular activities or things that you would expect someone to be able to do in order to progress then to a bit more impact, such as running?
Absolutely. So thinking about lower impact exercise initially, so walking, you can progress that to a brisk walk, again just listening to your body over those 3 months and building things up gradually. Some postnatal Pilates can be really good. Again, if you've got any sort of tummy muscle separation, those muscles should gradually knit back together over the course of the next year, but just gradually working on some abdominal strength with maybe some Pilates or some yoga, some swimming, static bike, that type of thing, just to kind of gradually improve your strength. Pelvic floor exercises, so starting those as soon as you can after having your baby, as soon as you can feel the muscles. Start doing some squeezes and building up the strength. Making sure that you're staying hydrated, looking at your diet, so eating nutritiously to help your body heal.
And is it right that even sleep and my lack of sleep, if I've got a small baby, can affect?
I was going to touch on sleep, but obviously that is out of our control somewhat in those first few years. But yes, getting a good night's sleep can also help, if possible.
And if I'm thinking about starting a running program, are there is there any kind of screening I should do, or?
Yeah, absolutely. So there is a postpartum readiness to return to running screening tool, and we'll pop a link on. And it just asks questions about symptoms, and then there's various strength tests so things like lunges, calf raises, just to check that you're strong enough to return to running as well. And if you're not, then sort of trying to do a little bit of strengthening to improve those things can be really, really helpful. If you are ready to return to run, doing something gradual. So even if you were running marathons prior to pregnancy, you want to build up gradually. So starting with something like a couch to 5k can be good, and generally sort of increasing kind of distance or speed by about 10% a week is kind of a nice gentle return. I always say to my patients, if you can walk briskly for 45 minutes, you'll probably you're ready to start a couch to 5k. Yeah, it's just about listening to your body and just building up gradually.
And we have made another video previously, which you can also access, which talks a little bit more about some ideas around sort of little drills to get back into that impact.
Yes, and also it talks about sort of exercise with pelvic organ prolapse as well.